Hey, welcome back, Gary Ron Fortune on. This is just another update on my upcoming knee replacement. I went to the doctor. I did one video already where I went to the doctor a few months ago, and then I had to go back. I think it was like 2 weeks ago for my 2 or 3 weeks ago, whatever it was, for my pre-op appointments. And then last week I made this whole video to post. Actually, a week and a half ago I made this whole video to post. Waited around a few days to edit it. Got ready to edit the video, and I had plugged in my boom mic, which I just made another video about the problems with that, and and I got no sound. So anyway, this is a real quick update. It's not much to talk about. One day I had all these pre-op visits. I had to go see my orthopedic doctor. Well, I saw the orthopedic doctor, the surgeon's PA, physician assistant, and she just kind of talked about what to expect, and made sure I had everything ready to go and all this other stuff. Told me what they expect of me, and then that was in the morning. I took the whole day off work and did that. It was a late morning appointment with them, and my wife and I went and had some lunch, and then had an afternoon appointment at the actual hospital where they do a little mini physical. That wasn't a whole lot. They drew some blood and for testing, which I never heard anything back. They swab just inside your nose. It's not like a COVID test where they go back into the back of your brain with them swabs, but they just get the front of your nose, and they're looking for some kind of a staph infection that really doesn't hurt you, but it can be on your skin, I guess. I don't know much about it. Like one of those staphylococcus things. I don't know what you call them. Anyway, so they gave me a bottle of this stuff to bathe in. It's like I guess an antibacteria thing or something. I don't know what it is, but you get bathed in it before the surgery. And what they did the nose swab, if it comes back positive, then they call me, and I had to do that bathing stuff every night for like 5 nights leading up to the surgery. And I don't remember if they prescribed something or not too, but anyway, I had to bathe 5 times. And then if they don't call me, which they did not, then I have to just bathe the night before and the morning of the surgery. And they gave me the bottle of the whatever it is, this scrubber thing, whatever it is. It's just like a round ball made out of mesh. I don't know what you call the thing. You have to wash yourself with it. You cannot get it in your eyes or ears. I think that was it. But anyway, you're supposed to wash yourself all off with it, and then just get out of the shower. So I had to do that here coming up. Anyway, I explained all this stuff, and and the doctor came in and talked to me, just a regular medical doctor, which that'll end up costing a few $100s, just because it doesn't really talk about anything. It just comes in and say, hey, you got any questions? We're going to do this, and check you because you got type 2 diabetes, and drink. They want me to drink water while I'm driving in. Just tell me to take my blood sugar. If it's too low, I can drink a Sprite or something that morning. Otherwise, I can't eat anything after like 11 o'clock. I go in on Monday, so I can't eat anything after 7 o'clock or 11 o'clock on a Sunday night, and then my surgery's not till 1 in the afternoon, so I'll be pretty hungry, but I'll be too nervous to worry about it. And that's about it. They checked all that stuff out, told me what to expect, told me to be there. They've called me 3 or 4 or 5 times. They made me pay up front. They made me do all this stuff. I guess in case I died or something. They want the money. And then I gotta get all the other stuff done and ready, and show up. And my wife's going to go with me and probably stay with me that night, and then bring me back home. I'm actually listed as outpatient, even though I'll be there overnight, because it's like 23 hours or something, which is cheaper on me to do an outpatient, but even though I'm going to be in there all night like a normal overnight, I'm just not being admitted as an inpatient. And that's it. I'll let you know. I'll try to see if I can get a video. If I'm not too nervous to forget, I'll try to see if I get some video at the hospital. I won't be in there very long, but I'll be pretty out of it when I come out of the knee replacement. And then I'll try to get some updates afterwards. And like I said, go in Monday, come home Tuesday, go to physical therapy on Wednesday. We'll see how this works out. Y'all have a blessed day. Bye-bye now.